Hello, everybody. Thank you very much for joining us today. We've got an awful lot to get through, so we're going to just absolutely go for it because so many of you have asked so many really important questions. So what I want to do first of all is to bring you up to speed. I'm just going to put this on my screen here because I've got loads and loads of notes for you. So just Roberta, have we got everybody in at the moment?
I think so. Yeah, there's no one waiting at the moment.
Okay, that's fantastic. Thank you. And we're recording. Okay, so lovely. So we'll start from here then. Thank you so much, everybody. I just wanted to say a couple of announcements. The situation, as you know, is very confusing at best, just blooming downright aggravating at worst in many ways. I think actually that the situation is that we probably need to talk about each of the different countries in the UK first, if that's okay with you, just to give you actual dates and what people are saying at the moment. Now, just to let you know, the two actual letters that I have in hand are one from Diane Dodds, who actually very kindly, she's the only minister that has actually come back to us as sort of individually, so to speak, and actually addressed our sector from a really thoughtful perspective. I think that's really the best way of doing it. Now, she's the Minister of the Department for the Economy. Her remit is business and economics and the economy. And anyway, she thanks me for writing to the First Minister and herself. I also wrote to all the health ministers as well, of course, obviously. They in Northern Ireland were quite happy for everybody to start back at the beginning of this week. And she did say, and I think very smartly, very understandably, that it is a fluid situation. And as a result of that, then obviously, we've just got to be smart about things. We've got to make sure that, we're not, that we're keeping an eye on the news and that we're not sort of doing anything against any kind of, or going against any kind of government guidelines. I think that makes sense. We're all grown ups, it's not exactly rocket science, is it? The second, the second letter, it's not so charming actually. This is from somebody delightful called Professor Jason Leach, who doesn't know how to spell complementary medicine. He also wrote it as Dear Therapist, lowercase, which is a little bit tacky and a bit not terribly clever, I don't think. I'm all for a little bit of politeness. Anyway, so what I wanted to say was he's written and said that actually, contrary to everything that was agreed by Scotland, with everybody going back to work, he actually wants to spend some time looking at individual close contact forms of complementary medicine to assess how each of those is going to reopen. Now, clearly, everybody else, all the other countries are taking very cleverly measured steps, and they are quite sensible, and they realize that we're not stupid. We are able to fully organize our PPE. We know how to read the instructions. We know how to implement the instructions. We know how to do risk assessments. I spoke to you about that a couple of weeks ago in the first sort of catch up on emerging back to work. So, it's quite disappointing. His position is actually quite disappointing. But having said that, I do think that there's a little bit of a light at the end of the tunnel, because the other 4 countries in the UK have actually said that they are happy pretty much with certain steps, and I'll go through those individually in just a second. But they're pretty much for us to start to get back into practice. And as I say, Northern Ireland is A-OK. Just to touch on something else, so I had quite a cross lady contact me and saying you're ignoring Ireland, the Republic of Ireland. And I said, no, we're not. We're absolutely not. We're not ignoring other countries. We are trying to just get our ducks in a row in a really systematic fashion so that we can actually give you proper considered advice. Okay, so please be patient with us. We have been working non-stop around the clock to get all of this straightened out for you. So, you know, bear with. So England is saying that they, at the moment, are allowing close contact businesses to open from the 13th of July with some restrictions. Let me just make sure I've got this for you. It's quite important we get all the wording right. As you know, Leicester is in lockdown again, more so than the rest of the UK. That's because it's a hotspot. So this does not apply to Leicester at the moment. So if you're in Leicester, I really want you to make sure that you are reading very, very carefully and just keeping an eye on things. But for everybody else in England, it's looking as though we're all okay for the 13th of July. The other thing I do want to say is everything I'm talking about at the moment is all about close contact, okay? Lots of you have asked me questions about PPE and so on. We're going to come on to that in a little bit later. What we can infer from this and what the insurers seem to be going along with, and we're trying to, we've got two insurers. We've got Westminster and we've got Baylands. Westminster have given a statement and to say that they're absolutely happy to cover everybody providing you're following government guidelines no matter what you do. Baylands have not updated their website for quite some time. I put a message through to David Baylan himself today. I've not heard back as of yet. Okay, so as soon as I hear from them, if there's any change to their current statement on their website, obviously I will be sure to let you know. But at the moment, again, they are also echoing the same thing that Westminster are echoing, which is basically, you know, just make sure you keep an eye on government guidelines, safeguard yourself, safeguard your patients. For those of us practitioners who are not close contact practitioners, as long as you're maintaining your social distancing adequately and you're putting into place as much sanitation, do the walkthroughs that I spoke to you about 2 weeks ago, do all your risk assessments, you should be absolutely fine. And that seems to be what's being echoed by the insurance companies. As I say, you know, it's a fluid situation, so keep an eye on the CMA Facebook page and Facebook group. Those are the two places that we're really concentrating on getting information out to you, because we can get it up really quickly, and we can chat with you there, and we can, you know, respond to you properly there as well. If we send you an email, it takes a while to do it. It takes a while for it to filter through to you. You may miss it and so on. So I just want to say to you, just keep an eye on the Facebook page. That's what we really need you to do. We will, of course, you know, keep the CMA website updated, but it's much more immediate. That social media interaction is much more immediate. So we want you to make sure, you're being active there. It's really important. So going on now to, let me just have a little look. Yep, so we covered Northern Ireland, Scotland. The next review for Scotland, by the way, is the 30th of July. Now, my feeling is that Nicola Sturgeon may kind of, she might use a bit of seniority here and actually push for things to open, because I think she's a very sensible lady, and so I think she may actually see Professor Leach's statement probably for what it is, you know, it sounds as though he's got a little bit of an axe to grind, so we're not even gonna, you know, spend too much time thinking about that, because we could all get horribly paranoid, and that's not what this meeting is about. It's just about facts, facts, facts. Now, as far as Wales is concerned, their statement literally just came out. I was sort of getting a bit down when I was preparing this meeting for you, because I was looking at, you know, Wales, the Welsh website, thinking, you know what, they haven't updated this since the 27th of June. And then, as if by magic, they must have known that we were doing this afternoon. Literally not even an hour ago, they suddenly came out with a statement. Thank goodness, it's quite helpful, really. They are actually, let's have a look. They are targeting for everything to reopen from the 27th of July. Final decision will depend on the health conditions at the time and the necessary preparations being in place. So that's for close contact. So again, they're not saying anything about the nutritionists, the homeopaths, people that, you know, where we don't put our hands on people or have any kind of close contact with them. So you know, that's actually quite positive as well. So again, they are moving forward. Wales, we need to have a little word with them because they're still talking about things in terms of spas and massage parlours. So honestly, don't get me started. Anyway, but don't worry, rest assured, we will be contacting them and making our feelings known, shall we say. So hopefully that's clarified everything as far as the UK and also the Republic of Ireland are concerned. Republic of Ireland, you're good to go. You can do whatever you like at the moment, pretty much, as far as their government is saying. I've posted something on the page for Australia. Again, you're kind of in the same boat as we are. USA, very difficult. I've been trying to post regarding the regs in the USA, but the problem with the USA, as you'll appreciate, is you've got 50 different states, all with different laws in each state. So having said that, most of the USA now is pretty much open and, you know, you're pretty much good to go there. That may change, of course, with hotspots like in Florida and New York and various other places springing up at the moment. So again, you know, the onus is on you to be as professional as you need to be in order to be able to make sure that you are properly reading everything that is absolutely relevant to your individual territory and jurisdiction. Okay, we can only go so far, but there are how many countries in the world, you know, we are global, so we do need to make sure that we are reliant upon you. If you see something cropping up in your area and it's something that we haven't covered, please do make sure that we're aware of it. So just ping it through. We do appreciate your engagement and your support as well. So, okay, now, does everybody know where the chat box is? If you mouse over your screen, you'll actually find at the bottom there the chat box. And so if you click on chat, you will see that on my screen, it's a little white bar at the side there. There's a chat box at the bottom. Hi Joe, you've got, hi, thanks Joe, appreciate you typing in there. So now everybody can see that there's a message just come up. So if you want to ask a question, then please do so. What I'm going to do right now is I'm going to go over the plethora of questions that you guys have asked. I just want to thank you actually for the brilliant questions that you've asked. Lots of things that I wouldn't have thought of addressing. So I'm just going to go from the top and give you my best information based on what I've read so far across all of the different government websites that we've looked at. So first of all, Andrea says, can we please clarify what PPE she needs for massage? She said, I'm assuming we can't stand at the head of the table either, but I'm not sure. We can't do facials either, can we? But I think a head massage from the back is okay. I normally do a lot of Indian head massages. Well, Andrea, you don't say which country you're in, but I think, if I remember correctly, I think you're in England. So what that means is that if you go back to the presentation I did, not last week, but the week before. Remember, we had a week off last week because we needed you to be able to catch up with all of the tutorials and broadcasts and just make sure you had a chance to actually read up and actually look at all those checklists and so on. If you go back to that one, you'll actually see that the checklists are all there. So how to do a walkthrough of your premises, what your PPE needs to be, how to take it off correctly, how to put it on correctly, how to take it off correctly, because there are procedures for all of this. So if you'd like to go back to that, everything is actually there for you. So that goes for everybody. Now, as far as close sort of really face-to-face, for example, if you've ever had you know, a facial, if you've ever had lash extensions or your eyebrows done or anything like that, you know that you've got a practitioner kind of leaning over you. What the information at the moment is that that's considered to be a very close contact, almost face-to-face type of treatment. I would be very clear when you look at the government guidelines that, you know, that you are actually protecting yourself. Personally, I think if you are doing something like an Indian head massage, I would say a mask and a shield is probably a sensible idea. Okay. And
Shield.
Shield, yes.
Right.
Right, okay. What I'm going to do actually, everybody, because we've got a ton of people in the group, so I'm just going to, if you bear with me 1 second, I'm going to just, if I can, actually, Roberta, if you can mute everybody except for me, that would be great, because we're getting, what's happening is we're picking up a lot of background noise, and the way that Zoom works, it kind of defaults over to where the noise is coming from, which makes things very confusing for everybody watching. So I hope that's clear, but there are more questions about this. Mute myself, there we go. All right, I got it, I'm back. Okay, thanks, Roberta. Okay, so we've got another question. Right, okay, let's have a little look. Can I confirm that we are still waiting for a date to legitimately open? Well, I've just been over that. So regardless of where you are in the UK and the Republic of Ireland and Australia and other countries, I think I've pointed you in the right direction, and certainly for the 4 countries of the UK, I think I've answered the actual dates. Apart from Scotland, where it's not quite sure yet, but we think we think we've seen a chink in their armour. Right. Okay. So. Right, what do we need to get the go-ahead from our professional insurance supplier? Well, actually, you've really all got the go-ahead from your insurance suppliers. Do you know what? I've been incredibly impressed with the insurance underwriters. You know, they have been really, really good. They actually realise that we are professionals, and you know, we're not sort of little fly-by-night operations. And they've actually said, as long as you're following government guidelines, and if you remember a couple of weeks ago, if you haven't seen it, go back and watch it. A couple of weeks ago, I did talk about what you need to do in order to stay compliant. Okay, on the CMA website, I've given you links to each of the different government's statements so that you can actually go there and make sure you're compliant in your own jurisdiction. All right, so please go back and make sure you do that. But as far as the insurers are concerned, as long as you're compliant, and I would always suggest to you, keep a paper trail. Okay, and I always say this in practice anyway, this is just really good housekeeping notes for being in practice or even running a school. Get everything in writing. So one of the things I do suggest you do is, if you've got patients coming to see you, or if you're opening up again to teach, then I would always suggest that you get everything in writing. So I have advised my client to wear a mask. I've told my client that they have to notify me if they've got a high temperature or a sore throat or any of the other COVID type symptoms. So you get everything in writing, okay? So sorry about that, I knew that would happen. I've got a delivery today and I knew it would happen when we got on this call. I'm just gonna leave it, so don't worry, we'll just let that happen. But anyway, so as I say, get everything, make sure you've got a paper trail, just in case, in the completely bizarre, unlikely, remotely unlikely set of circumstances whereby somebody was to contract COVID-19 and then say, aha, I got it from her when I went to get my reflexology appointment. Clearly, it would be very difficult for anybody to prove that. But if you've got somebody signing off on your statement, and as I say, don't forget, we've got that for you. We've got the notes for you on the CMA website, and also, of course, in the links on the video. So it's all there for you. So, you know, just use those as templates and, you know, you should be absolutely fine. Okay. So I hope that absolutely helps as far as what the insurers will do and what their position is. The next question is, what PPE should we have ready? Well, again, you know, all of that is actually laid out for you in those checklists that I've given you. So I won't waste your time by going head to toe with all of that, because it's already been done. It's all there for you. Right, she goes on to say, I'm a bioenergy therapist and feel that working with gloves on really isn't going to be effective for the client. So I'd be interested to hear your comments on that too. Well, with correct and really intensive hand sanitation measures, you should be absolutely okay. Again, as long as you are not putting grubby hands that you've sneezed all over onto somebody's face, which you wouldn't do, would you? Let's face it. I mean, you know, we are grown-ups, we are professionals here. You're not going to do that. So I'm really confident that you will be able to operate without gloves necessarily, if you have to, for example, with a reflexology treatment, a massage treatment and so on. But again, it's all about, you know, controlling infection. So if you are making sure that you are not going near somebody's face with any kind of sort of way that things could, you know, could be, what's the word, I suppose, transmitted in you know, sort of virus transmission from one spot to another spot. You know, we all kind of know how to do this stuff. So again, I think, you know, it's really very much a case of just, you know, read the data for your, read what we've said, read the data for your individual jurisdiction, your territory, and it should all be very, very clear to you. So Annalie has said, lovely Annalie was on the BBC just recently, and she was talking about, you know, the difficulty of going back into practice and wanting to get some clarification, and she very, very kindly mentioned the CMA in that article as well, as did Michelle. So we've had, you know, really, really great performance. Both Michelle and Annalie are CMA fellows, and they've been going great guns to really push things as well. And we need you all to get involved. You know, I know that this is something that you want to do. But what she asked was, what would I need to implement for treating clients in their own homes? I've now managed to get another treatment room to use nearby with a bathroom, so I can put all the necessities there. Excuse me. But how do I prepare for other people's properties? I also wondered about generating some form of disclaimer stating that I've confirmed to industry standards as required, and therefore any risk of contagion must be taken by the client. E.g., by signing this document, I acknowledge that having a skin-to-skin contact treatment in close proximity to the therapist, blah, blah, blah. Do you know, I think that's great, Annalie. Actually, again, I'm all about make sure that you've got a paper trail. If you've got a paper trail, if anything ever happens, then you can show the insurer and say, look, these are the steps that I've taken. There's no real, I've scoured the government websites across all the different countries. We've scoured them from head to toe. There's nothing about going into other people's homes that we have found as of the time and date of this broadcast. So I do feel that if that's what you do and that's the way that you work, I think you've got to make sure that you are properly protected, because of course you're going into somebody's home, so it means you cannot control the environment. Unlike your own practice where you'll do that walkthrough. Do you remember 2 weeks ago I spoke to you about it and talked you through how to do the COVID walkthrough, just to make sure that you are very, very aware of where people could touch things, where people could pick things up, you know, doorbells, door handles, anything that, you know, taps, anything where people can actually put their hands. So all of those you'll be very, very aware of. If you're going into somebody's house, you can't control the environment. So again, you're going to have to make sure that you can protect yourself, making sure that the person is really willing to tell you whether they've got a sore throat or if they're feeling unwell, if they've got a high temperature. All of those things you're going to have to be super, super vigilant about. That's really very crucial and very, very much down to you. We've seen nothing saying that you can't go into other people's houses. So just, again, keep an eye on that. Remember, it's a fluid situation, so that could change. But at the moment, it seems to be okay. So the next question is from, I believe this is possibly from Alison, I'm not sure. Right, okay, so here we go. Similar question, actually. I'm a mobile reflexologist, and although reflexology hasn't been specifically mentioned under the beauty salon spa businesses umbrella that are able to return to work, I'm assuming I can go back along with the massage therapists. Actually, yes, that is our assumption. We've not been told specifically, and I think that they would, because they don't really understand the the ins and outs and concept of reflexology, I think they would assume it's just a really nice foot massage. Obviously, we know differently. It is a nice foot massage, but it's so, so much more than that, isn't it? As we all know. So I would say let's lump ourselves in with that for sake of convenience, and then and take it that we can go back and resume work. And also the thing with reflexology is you're nicely distanced, aren't you? You're not breathing in the person's face, unless you're doing a very bizarre form of reflexology that I have not yet come across in my 3 decades of work in the complementary medical field. Anyway, so moving swiftly on, Alison, we've got so much to get through here. Alison says, I've been reading the government guidelines, well done Alison, and they state that a clear face shield visor must be worn by the practitioner, but it does not mention wearing a mask. I've been trying out wearing a visor, but find it fogs up if I talk and makes me feel claustrophobic. I'm much more comfortable wearing a mask. Is this acceptable, or does it not meet the required standards? Well, what I would say, Alison, is go back and look at those PPE lists. I think the idea behind a mask or a visor, not a mask, sorry, a visor, is that you are completely shielded. Now you can get visors, I've seen these, that actually stand away from your head. So it's not smack bang, you know, flat on your face. It does stand away. So it does actually give you plenty of ventilation. I've seen people wearing these in shops. So the fogging up issue as a result shouldn't be a problem. But what it does is if somebody was to sneeze, it protects your eyes. Don't forget that, you know, viruses do enter our bodies through all sorts of different places, including the eyes. So you've got to protect those eyes. So I don't really think in close contact work that just wearing a mask is advisable. If it was me, I would wear both, actually, just to be on the safe side, to protect myself, but also to protect my clients. So that's me speaking very personally, but I don't know, and I haven't seen any proscribed, you know, you must do this, you must do this, you must do this, sort of written down in tablets of stone and sort of essentially law. There's just guidance, and as I say, go back to the lists that we've already given you. So it is guidance, so you've got to really use your best judgment. But personally, I would say protect yourself. Or an alternative might be a mask and protective eyeglasses. If a visor's not working for you, then that is another option that you might want to consider. Okay, so just have a think about that. Wendy says, oh, this is a great one. Wendy, she says, I run Pilates classes in community and village halls. Is this social distancing still 3 square meters like for gyms? She says, it's not necessary in my opinion. Can I go instead for a 2-meter rule? We don't move around so much. Risk is much lower than for aerobics classes and so on. Absolutely, yes, of course it is. Yoga, Pilates, mat-based classes and so on. Yeah, I mean, really, again, it hasn't been written down. So again, we have to use our best professional judgment. I think that's really what this boils down to. I think 3 square meters is understandable in a gym situation because, you know, you've got people huffing and puffing and sweating and so on. Whereas, you know, when you're doing yoga or Pilates or any other sort of mat-based class, you don't really have that. So I think, you know, the 2-meter rule should really suffice. Unless, you know, the caveat to all of this is unless, you know, they suddenly change the laws and actually, you know, create other guidelines. But at the moment, I would think that that would be fine. So again, write it down, make a list of it, you know, just sort of clarify, put it in writing. Don't leave it. Don't leave this, because you know what it's like. You think, yeah, okay, I'll get around to doing that. And then you get really, really busy with other things and you forget to do it. My goodness. That would be disastrous. If somebody said, I went to your mat-based class, your Pilates class, your yoga class or whatever, and I caught COVID there. Well, if you've got something that says that you've asked people to sign a disclaimer that you're recommending the 2-meter, you know, based on government guidelines and so on and so forth, again, it stands you in good stead with the insurers. And that's really what, you know, is really important from a practice perspective. You know, of course, I'm not I'm not in any way minimizing the importance of safety to you and your clients. Please don't run away with that idea. But to keep yourself from an insurance perspective, because I'm really confident that everybody in this group is more than capable of keeping themselves and their clients safe. So that's that. She also goes on to say, I'm also an EMET therapist, so can I now offer my services, which needs to involve touching clients, happy to wear a face shield and mask as needed? Yes, it doesn't say that you can't. And also, of course, with EMET, you know, you're not really breathing into somebody's face. So I don't think it comes under that close contact kind of category, actually, unless I'm very much mistaken and there's a part of EMET that I don't know about. But certainly when I've had EMET treatments and when I've seen other people have EMET treatments, you know, it seems it's not exactly close contact. But, you know, again, use your best professional judgment. You're the practitioner of EMET, I'm not. Right, okay, so Philippa says, I just wanted to check what extra forms we may need and what needs to be included on the COVID-19 notice that we put up for clients. All of that is over on the CMA website. It's also under the program notes for the broadcast 2 weeks ago. We will also put them under the notes here, and in next week's CMA newsletter, we will reiterate all of that for you. So you've got it in 3 separate places. So yeah, it's all actually there. So I don't think there's any point in me kind of going over that, because all of those checklists are available for you. But as I say, whatever you do put your notices up. It's really, really crucial. Even photograph the fact that you've got notices up, again, to add to your paper trail to protect yourself, okay? I'm all for belt and braces all the way along, so every step of the way. So then we had something from Stephen. Right, okay. He was talking about another organization which seems to have kind of jumped a little bit ahead of themselves, and they're claiming to have government endorsement when they don't, which is quite naughty. So, you know, I think they need to sort of have a little rethink, shall we say. I'm not going to say who it is because it's embarrassing for them. Right, okay, so what they're saying is, to reduce risk of transmission, massage therapists working from home should, amongst many other things, reduce treatment time to 45 minutes per client, only see clients every other day, so only 6 clients per week, because of the rules around mixing with people from other households, refrain from working in the high risk zone around the face, neck, shoulders in supine position. He goes on to say, I work from home, as does my partner, who is a hairdresser, who is currently seeing up to 5 clients a day, or less if he is doing hair colour, because those appointments can be up to 3 hours. So the questions are, do you agree with this interpretation of treatment times, number of clients, and working every other day? So let's address that one first. This is just guesswork, I'm afraid. It's... you know, if somebody's carrying COVID and they sneeze within the first 5 minutes, well, it doesn't matter whether you're there for an hour or 45 minutes, does it? You know, that seems to me a little bit spurious, and I don't think it reduces, I don't think there's any evidence whatsoever that anybody has shown. There's no research on this, and it's total guesswork. So no, I don't think that it's, you know, advisable to protect or think that you're protecting yourself and falling into kind of a little bit of a comfort zone by saying, oh, well, I'm okay because I'm only doing 45 minutes rather than an hour or an hour and a half. I think be very, very careful about these types of advice and guidance because they're not evidence-based. So I think you've just got to be really, really super careful. So the other thing is refrain from working in the high risk zone around the face, neck, head and shoulders in the supine position. Again, you know, there are ways of protecting yourself, you know, with a visor, with a mask, and protecting your client. So actually, you know, follow the government guidelines for things like spas and beauty salons, because they are in that kind of working in that kind of distance. They've been given the go-ahead largely, except for the countries that I've explained about at the beginning of this. So, you know, I think that's where we have to take our cues at the moment. So I think that's a little bit overzealous. And he goes on to say, does the fact that I work from home in the same flat as my hairdressing partner affect the number of clients I can see? Gosh, it doesn't in law. That's the problem. It doesn't really. So again, you've got to use your best professional judgment on this. I think if you're able to work in separate rooms, that would be really advantageous, as I'm assuming you probably do, because if you're giving a massage, you know, you wouldn't be doing that in the same room as somebody's getting their hair done, I would like to think. So I think, you know, you can control your environment as long as your partner's controlling the environment as well. As far as vectors of infection are concerned, then, you know, I think you should be pretty much okay. But again, it's down to you to make sure you've got paper trails, you've got evidence, you can show that you are doing everything needed to be compliant and to be, you know, following best practice. Okay, why, he says, why is the guidance for hairdressers so wildly different to guidance for massage therapists? Well, the answer to that is because they don't really know what we do. You know, they're still calling us massage parlours. You know, so the problem is with government is that they actually haven't got a blinking clue about what we do. As I have to say, though, apart from Diane Dodds, who actually does seem to understand what complementary medicine is and gave a very, very sensible response. So, you know, bear with us. What I'm saying really is just bear with us while we educate, because the problem is that you know, you've got an awful lot of people there that really don't know very much about our sector and about our field. So really it's down to us all to come together to actually explain that we are professionals, that we're not running massage parlours and so on, and that this is how we work. So, you know, rest assured that we are working non-stop this end to get this done for you. Okay, so please bear with us, please be patient. Okay, right. Okay, let's have a little look. Who's this from? Oh, that's just, no, that last part there was just actually, was just Stephen finishing off by saying he's quite happy because in 7 years of being in practice, he's never had a claim. He's really convinced about the way that he works, and yeah, he's feeling very confident, which I'm glad about, because, you know, he's a great practitioner. And so I think, you know, he's just talking about putting everything in place, all of the guidelines and so on. So yeah, I think, you know, it all makes sense. Amanda Joy Harrison, my lovely Amanda, she said, so she's got a few questions for us. So what are the best cleaning solutions to use that will not cause therapists health problems, allergies and damage to the environment? Well, actually, when I read that, I didn't get straight back to her. I want you to actually ping that back to you guys, because I'm not a hands-on practitioner myself. I'm a homeopath and I do mind-body medicine and lifestyle medicine, so I'm not a hands-on practitioner. So I haven't looked at that, mainly because I'm also not practicing at the moment. I'm doing everything on Skype and distance, because I've got an international Skype practice. So I've not had to actually, you know, I've not had to face that. So, but I want to say, with you practitioners in the group today, can we actually discuss this amongst ourselves and tell me what you found to be the most useful, or what you think is safest for practitioners? Because I would love to know. So I'm all ears on that. So we'll come back to that one when we open the group for discussion. The next question is, are there any, oh, this was so great. Are there any additional questions we need to ask about blood coagulopathy? Great question. I asked Amanda to clarify that, because that question could go either way. It could talk about all those little minuscule micro blood clots that are seen in people who are symptomatic with COVID. On the other hand, the question could be, what about those people who are at higher risk of blood clots and have a higher coagulability, if that's a word, well, it is now. You know, are there any special steps that we have to take for them, because they are at a higher, they're actually in a higher risk group? If you are more likely to clot, you're more likely to succumb to COVID in a particularly bad way. You're in a higher risk group. She came back to me and she said, actually, the coagulopathy question is about those people who've had COVID who may have little micro clots. As massage practitioners, could you possibly start to dislodge those clots and so on? It's such a good question. The problem is nobody's done that research. So I can't respond as I would like to do normally from a position, from an evidence-based perspective. So what do we do about that? I think really you've got to be incredibly careful. If somebody has, if they've had COVID-19 and and you can actually, they will either have had a positive test or they'll have a positive antibody test, or they may just suspect that they had it. In those situations, and if you're a massage practitioner, if you're doing hands-on work, I would tend to be very, very cautious. Is there something else that you can do for that person that doesn't involve kind of really deep, deep work? I really do think you've got to be super, super careful. Having said that, on the flip side of that, there are very few people who will be coming to you who have had COVID. So, it's a question that may crop up and that you may need to be very vigilant about. But I do think it's such an important question, and I'm so glad that Amanda actually raised this as an issue. So if you are a hands-on practitioner and you're doing deep work, then I think you've got to be very aware of the possibility of dislodging microclots. So just bear that in mind. Okay. So she said, are there additional questions? Yes. I think really what you need to know is the person on any kind of anticoagulant medication? Are they on warfarin, heparin, or anything like that? What's their vitamin K status? Again, that's really important because obviously that's a pro-clotting, prothrombin type of agent as well. So, again, just make sure that you're doing your intake questionnaire very, very, very carefully to identify possible risk factors. Does that make sense, everybody? Are we happy with that? Okay, it's very important. Amanda Joy also says, I have health concerns around working while wearing a mask. Is a visor alone acceptable? Are there better mask options? I don't know, we didn't clarify, I didn't have time to get back to her to clarify. I don't know if you're in the group actually, Amanda Jo, I know you normally are. If you can clarify that and what your concerns are. Is it a concern about rebreathing lots of carbon dioxide? I know that's an issue for a lot of people. If you're able to, if you can pop it in the notes, that would be super, super helpful. Again, is a visor alone? Oh yes, yes, bless you, thank you. Rebreathing is the issue, thank you. Yeah, I agree with you. Again, possibly maybe wearing a visor, but then maybe just popping a mask on when for that particular part of the session where you are working really, really close up in somebody's face. If that's an option for you, I would suggest that, just to protect yourself and the client. And then maybe whipping, if you're finding that it's making you dizzy or what have you, then whipping it off. I would also, though, look towards the types of surgical masks that surgeons use, because clearly surgeons are able to do surgery for hours and hours and hours and hours without well, presumably suffering any brain deficit. We like to think that they don't when they've been working on us for hours and hours and hours. So if surgeons can do it, there has to be a way. So maybe look at those surgical masks and maybe look at the way that surgeons actually use them. It may be that they're putting them on in a slightly different way. There may be some trick to it. So perhaps if anybody knows any surgeons, in fact, I've got a couple of tame surgeons, so I'll ping them some messages and see if we can actually find out exactly what their procedure is, because clearly, it's not affecting them. So we need to kind of take a nod from them, I think. Right, what non-disposable washable PPE is needed as disposables are bad for the environment? Absolutely true. What my friends, my nursing friends have been doing is they've been putting on gowns that they can whip off and doff and don and doff in the appropriate way and put them straight into the really hot wash. It's a little bit of a difficult situation, isn't it? Is it really harmful to the environment to put things on a really hot wash that as hot as we need in order to be able to decontaminate them, or is it better to throw away a paper gown? I actually don't know the answer to that. So maybe some bright person can actually do the maths and let us know, because I honestly, I really don't know. So if anybody knows, please put it in the responses in the chat box. Can we work from home? Yes, we can. Amanda Joy, I've got a walkthrough for you, so go back to that. Are you insured? Yes, you are. She also says, if we come into contact with a client who later reports COVID symptoms, what should our response be? How do we track and trace and stick to GDPR guidelines? Okay, with GDPR, just to clarify this, it's such a confusing issue. GDPR is something that you have to set up on your website. It's a way of handling data. It's a way of showing that anybody who shares their personal contact information with you knows that you store that information in a really secure way, that if it's sort of on a website or internet database, that it's encrypted, which it would be that your computer has a password, it's password protected. If you are storing information in a paper format, that it's in a locked environment. So, you know, those are the sort of steps for GDPR. So when somebody actually comes along and starts to be your client or your patient, generally speaking, I tend to get people to sign off to say, yes, I understand that you are fully GDPR compliant and that I've read your GDPR statement. Okay, so if you haven't already, get yourselves a GDPR statement. We have one on the Complementary Medical Association website, so by all means you can use that if you find it helpful. So that's the first thing with GDPR. If that person is your client, then you contacting them to say, well, I don't know, you wouldn't know, would you? You wouldn't know that unless they tell you first that they've suddenly contracted or developed the symptoms of COVID-19. You know, you're not psychic, I assume, so I assume you don't know that they've done this unless they've told you, which kind of makes sense, wouldn't it? You know, then it's fine for you to go back to them and to give them your advice and help them and support them, because that's what you're here for, right? But also, what do you need to do? Well, you would need to, obviously, if you think that you've been exposed to them in that infectious window and you've not been doing all your PPE and so on, then you're going to have to self-isolate. Really, you're far better off, you know, literally closing the stable door before the horse bolts by making sure that you are really compliant and up to speed on all of your PPE. So with that, you should be absolutely fine. But it's such a good question. We probably need to actually get some more clarification on it. Right, okay. Jacqueline says, I was wondering about timing per therapy session. Is this different for clinic, mobile and home-based as we do all of these? Again, actually, Jacqueline, really good question. Again, there's no evidence about this timing issue. So I think really just deliver your professional services in the way that you do. Again, it's always for me, always coming back to, are you safe for you, safe for your client, and are you insured? Well, you know, the thing is that there's been nothing written that says you can only see people for X, Y, Z amount of time. There's no guidance for spas, there's no guidance for massage or beauty therapists or salons or hairdressers or anything like that. So there's no guidance as far as timing or duration of services is concerned at the time of this broadcast. So I would say just business as usual, as long as you're making sure that you're properly, you know, you are observing all of the government guidelines. Finally, she says, if nobody else has asked, what guidelines of face-to-face teaching sessions? Great question, because nobody else had asked. So thank you for raising this question. If nobody else has asked, what guidelines of face-to-face teaching sessions, class size, length of class times, as a lot are day classes, courses, workshops? Should these be broken down into 3 sessions, say, rather than a full day? Again, there are no duration guidelines at all out there. So I would say, you know, as long as you're observing this correct social distancing and you're not all sharing, you know, lunch and sharing bottles of water or any other kind of vectors of potential infection, then, you know, as I say, without any other guidelines, And as long as you make sure your paper trail is perfectly there and intact, then it seems to me that you should be okay. Again, as I say, this is a movable feast, so I would suggest that you do you keep a close eye on the CMA Facebook page, on the CMA website and so on, because if we do get updates, then we'll bang it up straight away so that you're in no doubt as to what the current guidelines are. Okay, so let's have a little look at all of the, wow, loads of questions. Thank you, this is great. Okay, so can anybody help? I have pregnant clients who want to come back ASAP. This is from Julie. I know they are a low risk vulnerable group. Can I offer treatments? Well, Julie, first of all, I don't know what you do. So it depends, doesn't it, really? It also depends where you are as well. So there's no guidance about treating pregnant clients other than the guidance that's already been given by the governments in the different countries as to when you can return to work. So with the absence of that guidance, as long as you're being sensible and professional, and if you treat a lot of pregnant clients, then I'm assuming that you are, that pregnancy is part of the work that you do on a normal basis anyway. So if that's the case, then I'm assuming you know exactly how to protect your clients. So again, keep your paper trail. Okay, where can we find, Carol says, where can we find the previous risk assessment advice, please? Okay, so what we do with these sessions is that we broadcast them live. Here we are doing it live. And then what happens is we save the recording, and then we get it transcribed, and we also get it subtitled so that it goes up on the Complementary Medical Association YouTube channel, and it has to be transcribed and subtitled to make sure that we are fully accessible to everybody with all abilities. So we're not excluding anybody on the basis of ability or anything like that. We're totally inclusive and very disability aware. So, although actually a lot of people with hearing deficits would not say that they're disabled, and I would say, I agree. Okay, so what I would say is if you would like to go over there, Carol, all of the links to the previous risk assessments and all of it all still stands. It's all up on the CMA website, and it's underneath the video, which is called Emerging from Practice. Okay, so it's all there for you. Again, we will also put it under this video as well. You'll get the link to this video on Wednesday, but it's all out there for you. I hope that helps. Julie says, also, are we sticking to maximum treatment time? Right, okay, I've covered that. So treatment times, there's no guidance. There's nothing out there being sort of set in tablets of stone. Yeah. Right, Wendy says, can I comment on the stance of insurance through the FHT? No, I can't, because we're the CMA. No idea what the FHT is doing. I've not seen, I did look at their site earlier. I've not seen any guidance on their website, so I've no idea what their position is, I'm afraid. Sorry about that. Right, okay, so Roberta very kindly said where the information about all the tutorials is. Thank you, Roberta, for doing that. Right, Andrea, oh, you're in the UK, yeah, okay, but don't forget, Andrea, each country in the UK has different guidelines, which is why it's been like herding cats. I'm constantly sending emails to politicians, and it's really fun, not. Okay, right, Philippa says, are the guidelines to wear a shield and mask just for our protection? No, they're for your client's protection and your protection. Okay, Benita, just search for the Complementary Medical Association on Facebook. Yes, thank you. Juliet says, do we have any guidance for disclaimer content? That's a very good question. Yeah, did we put something about disclaimer? Do you know something? Actually, I don't think we have. Roberta, would you be able to just take a note of that? Because it would be really helpful for people if we could write up a disclaimer. Now, obviously, you've got to bear in mind, everybody, you know, we're not lawyers, so we can give you our best disclaimer, but we would also caution you not to rely on it in a court of law, so to speak. But the sort of disclaimer that we would give you would be something just really, really sensible, like, these are the guidelines that I'm following, and you can then link to all of the information we've given you on the CMA website. And those are links to things like the Health and Safety Executive. There are things like NHS UK. There are things like the British Medical Journal. There are things like donning and doffing PPE, what kind of PPE you need, and so on. So they're really, really sensible links. So if you said, you know, these are the steps that I'm following, this is how I've done my walkthrough, this is how I've done my risk assessment, you can actually create a really good disclaimer, and it basically shows the person this is how you are handling COVID. Also put in the disclaimer something along the lines of, I have asked you to disclose whether or not you've been exposed to anybody with COVID-19, and I have asked you to declare whether you have any symptoms, and by signing this disclaimer you are indemnifying me against any kind of infection coming from you. Now, as we know, those sorts of indemnifications never really hold water in a court of law, but what it does is it shows that you've done your due diligence. So again, it will stand you in good stead with insurers. So that's where we would sort of go with a disclaimer of any sort. I really hope that that's useful and that that helps. To me, that seems kind of a logical approach. Okay, is there a PPE supplier I can recommend? No. Does anybody have any PPE suppliers? If you'd like to put something in the notes here to share with everybody, that would be really helpful. So thank you for that, guys. Is hot stone therapy a treatment that falls under the umbrella? Well, hot stone therapy is it's reasonably close contact. It comes under the umbrella of massage therapy. So again, if you kind of put yourself into the massage category with hot stone, then I think, you know, that then becomes quite clear, doesn't it? Right, oh, Julie says, sorry, this is from another colleague. If somebody says they've tested positive after seeing us, say within 72 hours, do we then get tested or just shut down for 14 days? Obviously, we have to then tell all clients we've seen, so I'm guessing we must get a test too, yeah. The problem with the test, as we know, is it's not always accurate, is it? I did a test and I found it incredibly difficult. I produced bizarre COVID-like symptoms about 3 weeks into the lockdown. I got my test far too late because I thought, no, I can't possibly have COVID, can't possibly have it. Anyway, it tested negative. First off, I don't think I probably had it, but I had something weird. And then also I couldn't get the swab far enough down my throat to do a proper swab. So it's really, really, really tricky. To answer your question, if somebody's tested positive after seeing us and you weren't using all your PPE and you weren't observing PPE carefully enough, then I think, you know, yeah, you've got to go into lockdown yourself. You've got to go into quarantine. If you are confident that your PPE is viable and you do a test, then I think you can use your clever brain and say, well, actually, the test is negative, and I did use all my PPE correctly. Therefore, I'm probably okay to go back. But you know something, I think this is something we need to double check as well. There's no guidance out there. This is the problem. This is the problem that we're facing. There's so little guidance out there. And you know what? It doesn't even exist for doctors and nursing staff. So, you know, we're in a very tricky situation. So I think if we can maybe, Roberta, if you can possibly highlight that and, you know, copy and paste it. I want to go and ask those questions and also do a bit of a deeper dive and come back to you all. You know, at the moment, I'm giving you my best guidance based on all of the data that I've read. But you know what, there may be something out there that I haven't read, so I just want to be absolutely sure that I'm really giving you correct information. So watch this space to come back to that question further. Okay, Wendy asks, do we have to clear the room except for essentials? Do we also have to do all form and note-taking through the internet and not in person? Actually, do you know what? Doing form and note-taking through the internet is a really good idea because it will reduce your exposure time. So I think that's really, really smart and really, really sensible. Okay, do we clear the room except for essentials? Yeah, actually, why not? You know, because the thing is, we don't know how long the virus lasts on surfaces. So that's, you know, that's clear. So if somebody did come in with something, you just don't know. We have no data supporting whether or not, you know, just by breathing and being there, because there's now this whole question, is COVID airborne? It could be, the scientists don't know, so we can't comment on that. So, you know, yeah, maybe sort of reducing everything that you've got in your room just down to bare essentials may not be a bad idea. It gives you less stuff to have to clean as well, because don't forget, you know, if you go back to my walkthrough information that I gave you, you know, you've got to sanitize everything. So if there's less in the room, the job's a little bit faster, but certainly overall and between clients. So, okay, right. Okay, so now we've got Christina. Regarding cleaning fluids, I've been using a spray with essential oils, tea, tree, thyme, peppermint, and I hope that these will be acceptable from insurance point of view. I haven't been adding alcohol, wondering if it's a requirement. Yes, actually, this virus, there's no data. Now we do know, this is really interesting, there are no data showing that COVID-19 is susceptible to the antiviral properties of any of those oils. Chances are it probably is, but because it's a novel virus, nobody has actually had the time to sit there and do that research, because also don't forget, there's no profit motive in doing that sort of research anyway, so it's not really at the top of any researchers' lists, quite frankly. So generally speaking, what we do know about alcohol, particularly for hand washes, you've got to be above 60%, ideally higher, alcohol content to disable the coronavirus. And don't forget that hand washing is still an absolute requirement, because it's hand washing that really does help to get rid of the virus and help to keep things nice and clean. So I actually don't think that you are really doing yourself the best service by just using those essential oils, because there's no data. I would like to say, for example, Jill Swires, my lovely Jill, has said regarding cleaning products, green scents. I don't know what's in green scents, Jill. Do you know what the alcohol content is, or if there's anything else that's been shown to be active against coronaviruses? Again, everybody, please remember that, you know, COVID-19, this iteration of the virus has not yet been tested. So it's not to say that it isn't disabled by these, but it might not be. We simply have no data. And I always like to speak from a data-driven platform. Okay, so using essential oils daily as well. Yeah, I mean, it's sensible, but, you know, as I say, the data. Okay, so, Michelle says, I'm a scrub nurse and it's just getting the noise nipped in correct, the nose. Sorry, it's me going cross-eyed. I'm a scrub nurse and it's just getting the nose nipped in correctly, and then tie one tie above the ears and one tie below. Thank you, Michelle. That's really great. So there is a technique in that case, because obviously, of course, as a scrub nurse, you are wearing, you're donning and doffing correctly all the time as well, and presumably not passing out, because otherwise we'd see people dropping in operating theatres, you know, because these operations go on for hours and hours and hours. So I think that's where we have to take our cues from. Thank you, Michelle. That is brilliant, brilliant information. Philippa says 60 degrees wash apparently for COVID-19. Well, that's actually not as high as I thought it was. So that's actually really helpful. Thank you. I didn't know that. So that's really, really helpful. And Michelle also says, when you're in a good position, try not to touch again, your mask again, I presume that is. Yes, that makes a lot of sense. Or not to touch your face. We all know that we shouldn't be touching our faces. Thank you so much. Super, super helpful. Okay, so Michelle says, I'm talking about clinical masks. And she says, is there anybody on the site today who I can get in contact with, as I'm just about to launch my website, but feel a bit overwhelmed with so much tech to get on top of it? Yes, email me. Okay, more than happy to help you. You know that. So as I always say to everybody, we're here to help you. You know, if you join the CMA, you know, that's what we're here for. You always get to talk to a real person, pick up the phone to us, drop us an email, send us a message through social media. We're here for you. That's what we exist for, to get you into practice, to get you successful and thriving, not just professionally, but personally in practice. That's what it's all about. Benita, thank you so much, lovely. And thank you for the lovely card that you sent us. That was just so lovely. You know, we've been working so hard here. We're absolutely shattered. And, you know, it's just those little messages of support and encouragement and just lovely things that you guys send through to us. It just, oh, it makes it all worthwhile. Thank you. Cannot thank you enough from all of us on the team. Right, okay, this has been brilliant for catching up with all the developments. Thank you, Rachel. That's really great. James says, do we have a track and trace form on Facebook or your website? No, we don't actually, James. Actually, again, sorry, Roberta, would you mind? I see you. Yeah, she's on it. Roberta's on it. Wonder Woman. That's why we call her Wonder Woman. Thanks, James. That's a great idea. Love it. Love it. Thank you. Right. Okay, Juliet. Yes, you're very welcome. Oh, Michelle says another thing to learn. Yes. Okay. Right. Oh, Susan, she's heard of Bunzl Greenham, but not yet followed up. Is Bunzl Greenham, is that a sanitization product? I don't know what that is. Okay, perhaps you can tell us, Susan. PPE supplier, Physique & Co. Oh, lovely. And Massage Warehouse website. Thank you. Thank you. Brilliant. Okay, everybody. So you've got that there. That's really helpful. So you guys, it's all about brainstorming, isn't it? So great. Do we need clients do we need to get clients to sign if they get symptoms within a certain amount of time? They need to let us know. Actually, yes. Can we, Roberta, can we add that to the disclaimer, please? Because that's a really, really good question. Absolutely, yes, because you can't rely on people, especially also, my God, if they're feeling ill, you know, their chances are not going to think, oh yes, I must let my reflexologist know I feel like rubbish. So anyway, yeah, yes, do put that in the disclaimer. So we'll add that for you. We'll make a little template for you. So I think that would work really well. Oh, thank you, Rachel. There's a place where you can buy a visor from. That's really great. Nisbets for PPE. Gosh, guys, thank you so much. This is great. Right. Julie says, I think most people are likely to pick it up in the supermarket. Yeah, or actually in Hastings on the beach. That's where you're going to get it from. I don't go on the beach anymore. Mind you, the weather's been a bit rubbish, so I haven't, you know. But yeah, honestly, the social distancing on the beach is absolute. Well, you saw Bournemouth, didn't you? It was just like that here as well. I think people have gone absolutely nuts. But anyway, that's a story for another time. Right, okay. Anne says, if I have clients from the same household with back-to-back treatments, do I need to clean between the treatments? Yes, you do. Yeah, absolutely. It may be that you can get a system going whereby you usher the person in, having had them do their intake form, which you've carefully read online. Therefore, you can literally usher them in, get them undressed and disrobed onto the couch. And then you've only, you know where they've touched. So you could get yourself a really clever system in place whereby they've only actually been exposed to certain areas, and you can, give that a swift going over. But yeah, anything that person has touched, anything that they've come into contact with. And remember, if they've used your loo, then you're going to have to go in there as well, clean all the taps and the sink and the loo and everything down. Doorknobs, don't forget about doorknobs. Don't forget that people actually touch doors in order to, open doors and things like that. It goes back to that walkthrough that I gave you. Okay, so please it's really surprising. It's really an eye-opener when you actually start to think, gosh, what could somebody actually potentially touch? So yes, between clients, definitely I would, for sure. Right. And it's, oh, sorry, hang on a sec. If I have clients from the same household with back-to-back treatments, do I need to clean between? Yeah, I still would. I would certainly give things like your couch and so on a good going over. I think it's good practice. It's good to get into the habit of doing it. So just, yeah, bear that in mind. Jane says, look at Neil's Yard Remedies with natural defense hand rub with essential oils, 70% alcohol. Oh, that sounds really good. Yeah, I like the sound of that. They're a nice company. Yes, okay, we support nice companies here. Okay, so Rachel says, so I'm going really fast because I don't want to keep you too long, everybody. I know we've gone over that hour bit, but if you're happy to carry on, I'm happy to carry on. Rachel says, I work in a combined area that houses both a retail area and treatment space. Am I guessing right that I should hold off before doing any massage treatments until the world resumes some sense of normality? If yes, I will continue as I am, offering consultations online and just opening the retail area. Thanks. Willida also do a hand sanitizer approved by the World Health Organization. Excellent. I love Willida. They're a really lovely company as well. You know, Rachel, that's a really interesting question. Obviously, I don't know where you are based, and also I don't know what your setup is. So if you've got a retail area that people are coming in, but your massage area is completely and utterly separate, then, and you're able to control that environment, does it really matter that people are coming into the retail area? I just don't know. Without knowing and seeing your setup, I just don't know. And I think I'm going to have to kick that one back to you to say, use your best professional judgment as to whether you can control the environment. And also, are you kind of popping into the retail area and doing retail things with other people and then going into your massage area? And if so, how are you controlling your PPE and all of that? You know, are you taking your PPE off to go into the retail? Are you then putting it back on again? You're going to have to think it through very, very carefully. There are no rules about this. The government has not made any statements about it. So this is really down to you to just use your professional judgment, I feel. And again, make sure you're doing your paperwork, you're keeping your paper trail, just in case your insurers ever said, aha, you know, we've had a complaint, or, you know, this person seems to have developed COVID after they came to see you. Just make sure you've got it all written down, photograph things, make sure you've got all the evidence and all your paper trail there. Okay. All right. Gosh, loads more things, lots of lovely PPs. Oh, Bunzel Graham, thank you. Bunzel Greenham, Bunzel, I guess that's pronounced. PPE supply, lovely, thank you. I was given some face masks when I took my son for a heart scan in an NHS clinic. Ah, they are FFP3 and NR grade and super comfortable and breathable compared. Oh, that's really helpful. Thank you. Lovely. Thank you very much. What if I have fabric chair coverings? Can you cover them with some sort of maybe couch roll or something like that that you can dispose of? I think that would be a good strategy. Instead of providing, instead of providing a glass of water, should we request clients bring their own? Yeah, I would actually. I think people are really quite happy about that. And also they know that they're controlling their environment by having their own water. I would do that. I think it's a great idea. Right, Rachel's in Northern Cumbria, and there's one space, but it will be shut down when I have treatments. Okay, fair enough. So you're actually in England. So follow the England guidelines that I've put up for you on the Facebook group, and also of course on the CMA website. My hairdresser yesterday offered us individual bottled water, but she said she couldn't give us drinks in plastic cups. That's absolutely fine. Really, whatever you feel is best, what works best in the way that you control your environment. Personally, I would ask people to bring drinks with them. It's easier and faster. So it's one less thing for you to have to worry about, I feel, really. Oh, Carol says she's new to the CMA and we're great. Thank you. Yes, we are. Yes, we really, really are great. But I'm really glad that you said that, because it's lovely to get that feedback. Thank you so very much. How do we dispose of used couch roll and other disposables? I would actually have a great big bag that you put your couch roll into between clients. Ideally, perhaps even outside the room, somewhere really safe and away from everybody else, so that you can actually just put it in there and then just leave it, and then at the end of the day take it all out and dispose of it so that you know it's been disposed of properly. Okay. Right, what about towels? Well, towels kind of come under, you know, think same as robes and you know, cloth-based PPE, that sort of thing. Again, you're going to have to remove your towels, put them somewhere safe, out of the way, so that nobody else is going to come and, you know, little children, you know, if you've got little ones at home, for example, you don't want little ones suddenly picking up a towel that somebody's been on, some stranger coming in from you don't know where, and you don't know what their exposure levels are, and then your little one has picked up a towel that's potentially infected. So just be really vigilant about how you actually handle things, and make sure you put things, just again, it's that mindset of going into what do they do in operating theatres, you know, how do they handle these things, and there's a lot of guidance on NHS UK on the GMC website, the BMA website, CMA website, and so on. So there's loads and loads and loads of guidance. We've given you all of these links, so do go back and take a look. Right, okay, what about Taz? Yeah, Chris, okay, I've been a hypnotherapist for about 34 years. So man and boy, you started very young then, didn't you, Chris? And right, so, I've adapted using Zoom for therapy, brilliant. A lot of angst at first about how well it would work. I'm glad to say it's going well from the COVID perspective, very safe, of course. Brilliant. Anybody, I would also say, you know, use Zoom, still use Zoom, even though we are, you know, tentatively reopening. If there are things that you can offer via Zoom or Skype or one of the other online systems, please do. Also, if you're teaching, you know, I would say this, what I think what Zoom has done for us, and other sort of online platforms, I think it's opened an amazing opportunity for us to actually take our work out further. So I'm not minimizing COVID in any way, shape or form, but I do think that it's given us this unbelievable challenge that we've all had to rise to. And I do think actually that it's kind of opened doors that we would never have even considered previously. So if there are things that you can do via Zoom, then do them. If there are things that you can do, if you suddenly, you know, if you always had this kind of hankering thinking, oh, I'd love to teach X, Y, Z. Well, you can do online trainings, you know, you can do these sorts of trainings. So yeah, I'd say, you know, maximize your use of these platforms because they're brilliant, they do work. Okay, right, so Christina says, I give people remedies as a kinesiologist. Do I have to wash the pots of supplements? Well, I don't exactly, so what you're doing is you're giving the person a pot of supplements, presumably to hold while you muscle test them. Have I understood that correctly? I'm assuming so. So, well, actually, I would, yeah, I wouldn't say you need to wash them, but I would certainly go around them with an alcohol rub. Between, you know, you don't want somebody handling a pot and then the next person handling the pot and the next person. So yeah, I think you've got to do that. You've got to make sure that your sanitation is all correct. Right, okay.
I have a question, Janie, from
Yes.
earlier on that you missed.
I did.
It's maybe quite important to some. Do clients have to wear a mask during a body massage?
Yes. Yes, they do. Yeah, yeah. I think it's really sensible. I think it's good practice. I mean, if the person is really claustrophobic and you're working on their feet, then, you know, clearly you're miles away from their, well, your body length, not miles, a body length away from their feet. Thanks, Roberta. That's brilliant. Sorry, I missed that question. They're coming through thick and fast, so I must have scanned up over it. I would say, you know, if your client is really, really claustrophobic and they're really having difficulty, then you can use the mask judiciously, you know. But if you're working on the head and so on, and you're in really close contact with them, just be safe, keep yourself safe and keep them safe, just get them to use a mask just for that short period of time. I think that's smart. I think that kind of makes logical sense, does it not? Again, nobody in government has said that this is what you have to do one way or the other. So this is my best advice based on years and years and years of practice, but also speaking to you guys and benefiting from your expertise. So if somebody wants to chime in on that, you know, bearing in mind, I'm not a body worker, so if as a body worker, you've got an opinion about that, please put it in the discussion. It's really important. Thank you. So I'll wait for, you know, more statements about that to come up, but I think, you know, you can use it judiciously. If you feel I'm wrong, then let me know and we'll, you know, we'll come back to that. Right, okay. Where can we dispose of disposables, because they cannot go into standard waste? And disposables, Sandra says disposables can go into waste after 3 days. That's it. So I'd keep everything all sort of bagged up, out of the way, and then it's annoying though, because there's no actual scientific research on this. Again, it's guesswork from the powers that be. But yes, if you can keep it somewhere for 3 days and then put it into standard waste, you should be fine with that. Where are we supposed to store the waste? Well, I don't know how your practice is, but you know, if you can dispose, if you can put it into black bags, I'm not happy about putting more plastic into the environment, but at least you know it's a, you know, it's a bag there that is a do not touch bag, and if you can mark it as so, if you can just put it somewhere, then you know you should be okay, but you're just going to have to find a way of doing it, I'm afraid. Okay, so Julia says, I found very clear advice on ukmeds.co.uk about masks and how to put them on. That's really useful, thank you. Compels.co.uk are a really cost-effective supplier. Don't like the word cheap. No, Sharon, I don't either, but yeah, cost-effective. Always good to know, because we're going to be going through all this stuff like, you know, like crazy, aren't we? Okay, oh, thank you, Jill. That's absolutely super. Really, really, really nice of you to say so. Thank you. Right, okay. Sharon says it should say Gompels. Oh, Gompels, GOMPELS.co.uk. Gompels is really good for cost-effective supplies. Thank you, thanks for clarifying that. Christina says, can clients bring and use their own masks? Yes, of course they can, absolutely. That's absolutely fine, and yes, you should encourage them to do so. Right, okay, righty-ho. Any other questions? By all means, unmute yourselves. If you've got any questions that you would like to either write or ask, please do so. If not, I'm more than happy to let you get on with your day. I do hope this has been useful. You know, as I say, we are absolutely shattered this week. It's been absolutely hellish trying to herd, it's like herding cats, honestly, writing to all these politicians, chasing them up, and they bury their contact details in, you know, three-click policies and things like that. It's absolutely horrendous. I'm not saying this to tell you, oh, poor us, not at all. This is our job. This is what we're here for. We're here to help you. This is our job to do all of this stuff. But quite honestly, I do just so value your support and your patience. And we rely on you. If you spot something that we haven't seen, because, you know, we're not perfect. If there's something out there that we haven't seen, ping it through to us, please. We're relying on your brilliant brains to also keep everybody informed. By working together, we will get there. So, okay, right, let's have a quick look. Thank you, thank you, thank you. Oh, you guys, you're so lovely. Thank you. It makes it all worthwhile, honestly. It truly, truly does. Right, okay, let's just have a quick look. Any other questions? Oh, lovely. I'm going to actually print out all this so that when we go through the dark days, like this morning I was having a really dark time because Wales was like, you know, their advice was from 3 weeks ago, and I was thinking, what am I going to tell you guys today? I've got nothing to tell you about Wales. And then finally they came out with their steps. So sometimes, you know, we do get a bit, you know, a bit frustrated and a bit down, but okay, thank you. Right, okay, lovely. Any other questions? Any other questions? Oh, okay, lovely. Great. Yes, there is a question. Okay, I'm just going to praise it because it's come through to me privately. So I'm going to praise it because it might be a personal question, but I think I can generalize. Do we have to change uniform after each client? Yeah, okay. Right. Oh, it is a question for everybody. All right, lovely. Yes, okay. So I'm taking my cues from all of the nurses I know, but obviously, you know, Michelle, you're here, you're a scrub nurse, so you can correct me if I'm wrong, but I've got an awful lot of friends who are nurses, and a lot of practice CMA members are doctors and nurses and theatre crew and all the rest of it. So what they're doing is they're actually putting on, so they've got their uniform. My friend Heather, who she's the chief nurse at the walk-in clinic here in Hastings, what she's doing actually is she's using aprons, a visor and a mask. And then sort of every couple of clients, she's actually completely taking off her uniform, putting a fresh new uniform on. Actually, and my other friend, who's a seamstress, has actually been sewing uniforms for Heather. So if you've got friends who can actually stitch a sort of something up for you that you can that you can just kind of keep replacing throughout the day. If you're a really busy practitioner and you're seeing client after client after client, I would use an apron. I hate to say plastic apron, but if, you know, I think at the moment needs must, because the thing is, you can take it off, you can put it into your little bag, and again, it can be disposed of in the correct manner. Again, you might want to go back to our lists of PPE and how to don and doff and all of that, because again, there's lots and lots of government guidance, which is far, far better than I could even give you. So yeah, I think, just again, using your professional judgment and our guidelines, okay? Right, okay, lovelies. Any other questions before I let you go? Are we all okay? Can I have a show of thumbs if we're all good? Can I just click along just to see all your beautiful faces? Oh, thank you. Oh, thank you so much. Thank you for being with us. It's been a beautiful session, really, really busy. You've asked the most amazing questions here in the group and also by email, so I cannot thank you enough. Lots of love to you all. Stay safe, stay well, and we shall see you very, very soon. All the very best. Take care. Bye.